please join me in welcoming Joyce.
Very honored to be here today and to speak to all of you about something that I feel very, very strongly about. I was kind of surprised back on Tuesday when I got the call that I might be selected for this, and I want to thank Tim Granholm from the Health and I asked him about that this morning, and he said that the Health and Human Services Department, who kind of, I think, got the ball rolling. I am a clinical social worker working in Macomb County for Macomb Family Services, and I have a distinct honor of serving a large variety of population. And one of the things that I have noticed as I go through it and talk with people is that the issue of health care is a common one that gets brought up in sessions. One of the most frustrating and disheartening aspects of my job is watching my clients struggle to pay for treatments and medications that would stabilize their illnesses and help them to maintain their productive lives. All too often, they are forced to choose between buying the medications they need and the treatments they need in order to pay for, or to pay for their household expenses like heat and food and shelter. And of course, all too often, the health care gets pushed on the back burner. And when that happens, I watch as their symptoms increase and their families have to struggle with the symptoms. Their jobs oftentimes are laid on the line. It's tough. And though this is a choice that no person should have to make, they're faced with it. All because they have no insurance or because they have co-pays that are so high they can't afford them. But my desire for a changed healthcare policy doesn't come from my experience as a social worker alone. On a personal basis, my husband and I live with a very real threat of falling into the ranks of the uninsured if my husband's job with General Motors, and we know where things stand right now with that, were to be eliminated. This is especially anxiety-provoking as both he and I are cancer survivors. As you can imagine, battling cancer is a very difficult disease under the best of circumstances, but facing it without insurance would be a horrific burden. My breast cancer treatment alone cost over $100,000 8 years ago. I was fortunate enough to have insurance. Someone faced with this disease and without insurance would be likely to be forced to choose between a chance at living or bankrupting their families. Or they could choose to die. But speaking to a much larger issue, as someone who lives in the Detroit area and whose community, life, and livelihood are benefited by the success of the Big Three, I have watched as our struggling automakers have lost ground to foreign manufacturers who are not faced with the same healthcare responsibilities. The healthcare issue is now beginning to undermine the very fabric of our nation, and large businesses employing thousands are forced to close doors and lay off employees, due in part to the healthcare crisis. These are the challenges that my colleagues, my family, and I faced and chose to address at our healthcare discussion group last December. For the first time, we felt that we had a president who was receptive and encouraging of the input from all Americans, and we wanted to lend our voice to the chorus of others who have been clamoring for change. Now, standing before you today, I must admit to having more than a glimmer of hope that we can work together to bring a comprehensive American system of health care that will provide health services to all, regardless of race, creed, or color. And I'm looking forward to participating with you all in that endeavor. Thank you.